And in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, January 17th, 2023, on the Zoom platform and in accordance with the town's policy directive and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphones unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town website. All committee votes will be taken via roll call. We'll start with an attendance roll call. I will announce your name. Please reply. For members of the public, please unmute yourself when I've opened the meeting to public comment. So Mark Haddad.
Present.
Kurt Herman.
Present.
Randy Prang.
Present.
Thank you. And I am Jill Block as well here. So welcome all and welcome staff and our guest, Marissa Morello and Cheryl Sabara. Thank you. We're going to really rely on your expertise in a couple of minutes. But first, I just wanted to do some introductions because we have two new board members here tonight. I'm really excited. I'm disappointed we don't have Jim Whalen, our other board member, with us tonight. But we haven't been a full 5-person board for quite a while. So it's really, I'm really pleased to have everybody here. I want to do a little bit of an introduction for everybody. We have 2 new members, but we also, a lot of people don't necessarily know what expertise I bring to the table or that Mark does. And you don't necessarily know the staff either. And I think it's really nice so that we all do have a sense of one another. What we do when we are looking to fill this board, we do look for a range of perspectives and skill sets to have. And given that it's a board of health, certainly having a medical background is really important, but which is what, Dr. Kring brings to us tonight. But we also, so much of what we do are also things that are environmental health. And for that reason, I thought that having environmental engineering or that sort of background was important. And that is where Kurt Herman is coming to us with. So just to get us started, I do want all of us to take a minute to introduce ourselves and tell us what expertise we bring. So for instance, I'm Jill Block. I do have a background in public health. I've worked in public health research and consulting for well over 30 years at this point. I'm sorry to say it's that long, but it brings a lot of expertise to the table. Started out working in maternal and child health, and particularly risk-taking behaviors within that, family planning, and risk-taking behaviors then became substance abuse work. I've done a lot of work in substance abuse prevention, opioid misuse. It's where I first met Melanie on some of that work and some of the coalitions on the North Shore. And I've also worked a lot with local boards of health and state and public health departments on just technical assistance, doing statewide needs assessments on health-related issues. So, and I was first introduced to the Board of Health or the health department as a consultant working on the Healthy Communities Planning Project. So know this department pretty well as well. So that's me. Mark, why don't you tell us a little bit about yourself since you're one of the more senior members here as well?
Sure. So hi, everyone. So Mark Haddad, I am a business lawyer. I'm a partner at Foley Hoag, which is a law firm in Boston, which I'm actually sitting in for a change for this meeting since we're on Zoom. My background is really more transactional, although I definitely work with a lot of healthcare companies and life sciences companies, but I've been now on the Board of Health for quite a while, so I've learned a lot along the way here. And I'm also the one who annoyingly always sends Karen comments on the minutes. So
it's a great thing.
It's a good thing, Mark. I love it.
Yes, thank you. Kurt, can you tell us a little bit about yourself?
Yeah, sure. Well, nice to meet you all again. My name is Kurt Herman. I've been in Concord for about 15 years, and I've got about 25 years of academic and professional experience in environmental engineering and geology. And what I specialize in is really site-related issues for contaminated sites, understanding the way chemicals move in the environment, interact with the environment, and how people become exposed to them. And I also have expertise in water quality issues, both of which I understand could be relevant to some of the work the board's doing. I work for an environmental and risk science consulting firm in Boston called Gradient. And there I'm a principal and also chief operating officer.
Great, thank you. And Dr. Kring.
Yes, a pleasure to meet all of you. My name is Randy Kring. I am an emergency physician at Emerson Hospital. I've been at Emerson for 3 years. I've been living in Concord for 2.5 years now. I graduated from Tufts Medical School in 2015 and I did a residency in emergency medicine at Maine Medical Center in Portland, Maine, and was there until I moved to Concord. And I work with Deb Green at Emerson in the emergency department. She connected me with or basically told me how great it's working with the Board of Health, and connected me with you all for joining. So I'm excited to be here and hope I can provide some relevant insight to the board's workings.
Great. Thank you. I'm really excited to have all of you here with us, and bringing these new skill sets to us is really important. I know it's been very important to have the connection to Emerson Hospital, and really appreciate that we can continue that with you. So next we are going to meet Marissa Morello, who's our new tobacco compliance officer. Thank you for joining us. We also received a lot of information from her to prepare with some background on the work she's been doing, as well as some of the information that she provides to the vendors, tobacco license holders. And then today we were updated. You should have gotten a late email that had a recent violation that was found. So Melanie, actually, you were going to introduce this as well. So please.
Sorry, Zoom's being funny with the mute. No, that's no problem. Keep going, Jill. Don't stop.
Oh, no. Well, if you have nothing else to add, I'm sorry, I just kind of leaped into there. Then Marissa, you can kind of take it away then.
Okay, I can take it away. So although I'll start with saying, although we did have a violation, I have completed all of the stores for compliance checks, and that was the only one. Every single one of them asked, and it was very easy. They told the miner, no, I need your ID or there's no sale. So this was, an outlier. Everything's been going great. But as far as my background goes, because you don't know me yet, I have a master's in public health. And my focus was on risk-taking behaviors in teens. So same thing there. For the past 4 years, I've been on town coalitions. So one of them I was on for about 3 years. And I worked with the principal of the middle school, working to update the education program. And there were probably only 5 people allowed on that coalition. So we looked at everything from social, economic, every part that you could imagine on why we would send out surveys and collect data like epidemiologists would. Also, I am now in a role where I'm working on a disabilities committee. So about 4 years I've been on committees, and I'm pretty new in this role. So I've been doing this since mid-September.
So Concord has, for you new folks, 14 tobacco permits. So 14 permits that we, Marissa had given you in your packet a nice summary of the educational materials. I wanted all of you to have a copy of that. So there's just the outreach and education folder that she had prepared for everyone. So you have part of that extra paper is my fault. I wanted you to see the work that she's doing for the education and outreach portion of the compliance. All right, sorry about that. I wanted to add that.
Thank you, Melanie. Also, what wasn't in that packet was digital calendars. There's digital calendars that I order for free through the FDA website, and I bring those along to all of my education visits. An education visit is an inspection, but we like to educate the retailers while we're there so that we can, give them the information, give them the tools that they need to succeed. And they're doing great. I've found some trends. I don't know if you want to talk about that now, but
yeah, I think you should share a little bit, just top line of what you've been seeing. I thought that was interesting.
Yeah. So signs are something that all customers need to have, all retailers. And most of them have them, but they're just all in the wrong place. So I just give them new signs. I mean, they're in compliance, they have the signs. They're all facing outside. but they have to face the customer. So I just give them new signs and I help guide them on where it might be appropriate, because sometimes it's hard to find some wall space for that, but we get it done. Mostly I'm seeing missing manufacturer's letters. Now that's a big deal, because that basically is the manufacturer testifying that there's no flavors or enhancers, and that the nicotine content is not greater than 35 milligrams per milliliter. So that's something that I'm working really hard on, and I'm getting some great results, because they know they're not allowed to sell products if they don't have those letters. I teach them how to get the letters. I'll work with them. I'll get on the phone if I need to, which I have done before with distributors. So the goal is compliance, right? And the last thing that I've noticed a lot in Concord is that the local regs say that you need cigars to be 5 packs or more, 5 in a pack or more. But most of the retailers are selling 4 packs. And although they say that they haven't heard about this, it's in the regulations. So I'm urging them to read them.
Thank you.
Thank you. You know, I'd say that Mark and I started on the board, was it 6 years ago, maybe? And I'd say that maybe this is the second or so violation, and maybe only the first underage sale that I recall. I think the other violations have been, it was on e-cigarettes or flavored at some point. So I think we actually do have a pretty well informed vendor group, and that often the mistakes have been, the violations have been uneducated sales clerks. So I don't know if that's what you've had, what was observed today or recently.
Yeah.
But you know, I think for the most part, they want to do the right thing.
Yes, that's what I've observed as well.
Great.
Thank you.
Thank you. And that's a great segue into kind of the next big ticket item on this agenda. So there was as way of background, prior to the pandemic just kind of superseding everything, the Board of Health spent a significant amount of time developing and discussing new tobacco regulations, where we were going to eliminate flavored tobaccos. I mean, that happened actually earlier, right? And then we were discussing regulations that would have limited the sale of tobacco products to adult-only retail tobacco vendors, which, because we don't have any of those, essentially meant that we would no longer have sales. The other part of that was that the existing permits would be phased out over time as they came up for renewal. So over time, we would have eliminated the sales in town. That was December 2019, and we held public hearings at that time. We closed the public hearing segment, and Cheryl Sabar, I'm really glad you're here, because you're going to be as much of our institutional memory here, as well as Karen, thank you, and Mark. But we tabled any of our voting on these because at the same time, Governor Baker put in the state regulations that essentially did a lot of what we were proposing. And we decided to hold off on moving forward on our regulation to see what happened with the state. And then we didn't revisit it that June, as we said we would, because we were just COVID, ridden with everything. And so that just became the priority, and we just didn't have much bandwidth for much else in that time. So here we are back, and Cheryl, thank you so much for that deep dive you did into our regulation versus the existing regulation that the state put into effect. Can I turn it over to you now to kind of fill in what I just said and expand on that and tell us where we are? And you have to unmute, Cheryl. Thank you.
Why do we always forget that piece? Absolutely, I'm happy to. I remember this very well. And at the time, Concord's proposal was on the heels of something that had happened in a town in central Massachusetts called Westminster, where they proposed a regulation that would have prohibited all tobacco sales permits in the town. And that regulation was not well received by the townsfolk at all. It was, I mean, we had, when the hearing, well, the hearing that never took place, when the hearing was scheduled, we were there with about 500 other people, including press from across the world. And I'm not kidding, they were from Denmark and Italy and, you know, many, many different places. Suffice it to say, it did not go anywhere for lots of reasons, but there were some lessons learned. It wasn't the right municipality to try something like that, because it had no support whatsoever. There just hadn't been a lot of outreach or education done on the process. So Concord, Ray Considine was on your board at the time. He is a colleague of mine, and he really was driving the bus when it came to this policy. It did get tabled. What I was asked to do by Melanie, and I'm happy to do it, is to look at what your current regulation, which I think is from 2014, if I remember, what your current regulation, which was a very proactive regulation at that time, what it currently has and what it doesn't have, and we're going to look at it in two different ways. We're going to look at what should be in there, because that's what Marissa is enforcing, what should be in there because it's now state law, and she can enforce it even if it isn't in your regulation, because state law, because it's stricter, preempts Concord's law. So Concord's law is less strict, so she needs to enforce the stricter law, which is the state law. But it would be nice for your retailers to have the local regulation looking like the state law, so that they can understand what the state law is. Even though I know Marissa's done education, it's nice to have both laws that look the same and that aren't conflicting with each other. The other piece would be to explain some of the new strategies that are in the most recent template, which we actually have just, my colleagues and I have just updated it within the last couple of weeks to really bring it where we think it needs to go. So if that's all right with you, what I'd like to do is just briefly go through what you have and what we're suggesting and where Concord's reg needs to be updated to bring it up to the state law, and then could be updated further if the board chooses to do so, to add some new strategies. So the first piece is the statement of purpose, and we have updated that with new citations. And that's basically the rationale for why the board is considering enacting this regulation. What are the reasons behind it? What are the public health reasons? What does the epi research say? And what does the case law say? So we've updated those whereases. I'm not going to go through them unless someone really wants to hear them, but you folks probably know what they mean anyway. The definition sections, there are some definitions that you don't need any longer in your Concord regulation because of the state law, and there are some definitions that you do need because of the state law. And then there are some definitions that would be good to have if you do decide to go further than the state law and adopt some of these strategies. So again, I'm not going to go through all of them. BD is a product that doesn't exist anymore. It's not being sold anymore. So that definition is just unnecessary. We have added a definition for adult-only retail tobacco store. You have a definition for retail tobacco store. We have a more comprehensive definition that basically has been created as a result of lessons that we've learned in adult-only retail stores. You would want that definition if you want to prohibit adult only retail stores, you would want that definition in there. If you don't have any and don't really care if you get them or not, you wouldn't have to, but I would suggest adding that definition just so it's clear what they are. Blunt wrap, the definition of blunt wrap we have a more comprehensive definition, again, because of what we've learned in the field when we've seen these products. Other definitions that you don't have that are in the state law is child resistant packaging. There's a requirement that products need to be manufactured and wrapped in a way that kids can't get at them. The cigar definition is more comprehensive in the state law. There's a definition of constituent, which you have, coupon, which I don't believe you have. And the ones that are in yellow on your sheet are the ones that are in the state law. So those are the ones that I would respectfully submit that you would probably want to add to your local regulation, all the ones that are in highlighted in yellow. Flavored tobacco product is a really important one because your regulation exempts menthol, mint, and wintergreen. That now is prohibited in Massachusetts. Those flavors are also prohibited, so that definition should be updated. Liquid nicotine container is a definition in the state law, as are listed or non-discounted price, manufacturer documentation, which is what Marissa was speaking about. We have included a definition of that. That actually should be in green because it is our own definition of what a manufacturer's letter is. And then rolling papers is a new definition. The reason it's new is that it was initially, locals were preempted from regulating them. The state law that passed in 2018 took out that preemption. So if a board wants to, they can prohibit flavored rolling papers because they would be a flavor enhancer. Smoking bar is another definition that is in the state law. You don't have that definition in. Flavor product enhancer is another definition in the state law. Tobacco product is a much broader, more comprehensive definition in the state law, which means you can take out snus and e-cigarettes because the comprehensive definition would include all types of tobacco products. And then now that the state law is you can't sell to anyone under 21, you just take out the reference to minimum legal sales age and just follow the state language for not selling to anyone under 21. The signage requirements are new. They're more comprehensive, and that's the state law now, and Marissa knows them very well. There are more signage requirements in the state law. The identification section now reads that every person needs to show an ID. It's basically the Fenway Park rule, where it doesn't matter if you're 102, you still need to show an ID before they will sell you any alcoholic beverage. That's now in the state law. Permits, you have most of the requirements that are, there are certain local strategies that we would suggest that you consider adding. And those, the most significant would be what the chair has already mentioned, looking at some density strategies like capping the number of permits, permanently reducing them if someone is selling their business and to an individual that wants to turn it into a dry cleaners or, something that's not a convenience store or a retail tobacco store. That permit would then be permanently retired, and over decades, you would gradually reduce the number of permits that exist. So the basic capping strategy would just be to set a number of permits and say there can't be more than, and I think you said you have 14 now, there couldn't be more than 14. And then the advanced would be to permanently retire those that are being returned to the Board of Health so that they continue to go down. Other density strategies would be to not issue a new permit to someone who is within 500 feet of a public or private elementary or high school. Another would be to not issue a new permit to an applicant who's within maybe 500 or 1,000, whatever the board would determine, feet from an existing retailer. And again, that's a long-term strategy to address density. You could prohibit smoking bars. Right now, I don't think you address smoking bars at all. You may want to do that. And I was not aware, just what Marissa said about the 4-pack of cigars. Your current regulation says, as she said, minimum 5-pack. That's a local strategy. So you could limit it to 4 if you want, or you could keep it at 5 and do the enforcement that you need to do. And the price point has been updated because the price point is to follow the consumer price index. And this has been the price for the $2.50 and $5 have been for a single, and then a multi-pack has been in existence for at least 15 years, I'm going to say. So Boston increased their price based on the consumer price index. So we've added the new, instead of $2.50, it's $2.90 for a single. Instead of 5, it's $5.80. That's a local strategy. We've added some language to the prohibition of flavored tobacco products, which we probably don't need because saying no one shall sell or distribute or cause to be sold or distributed would really include products that are just on a shelf. However, we've had a couple of retailers try to say, well, wait a minute, they're here, but I don't really intend to sell them, which is a ridiculous argument, but we've added shall possess, hold, or keep just to avoid that argument. Another one that Marissa also alluded to is nicotine content. The nicotine content in vaping products. Now, the only folks that can sell a product with more than 3% of liquid nicotine would be an adult-only retail tobacco store or a smoking bar. Everything else has to be 3% or less. And then I believe you already prohibit the sale of blunt wraps, and then there's a coupon section prohibiting the distribution of free samples and prohibiting the redemption of coupons. Those are in the state law. Out of package sales, they're also in the state law. Self-service vending machines, prohibiting them. And then the next big decision that you would make, first of all, you would have to increase your fines, which Marissa is doing now. State law provides fines of $1,000, $2,000, and $5,000 plus suspensions. Those fines are required for those state law sections. If you want, you can still keep your 100, 200, 300 fines for those strategies that are just local strategies. Or you can decide to just have a unified fining structure and just use the state fines for everything. I've put in the 2 different options, and we also have a section which indicates which policies are subject by law to the state fines and which could be subject just to the local fines. And I believe that's it. That's those are the and then we have some, in the case of 4 violations or repeated egregious violations, the board can hold a hearing and determine whether or not to revoke. a tobacco sales permit. There are issues like that that are in there as well. And that's about it. And you know, you can certainly, I believe I gave you a checklist too, where the board can review this and see whether you're interested in some of these new strategies or not. And if you are, that's great. I'm happy to draft this. Well, it is drafted specifically for Concord, but I'm happy to do it any way you want, whichever strategies you're interested in or ones that you're not interested in, we can delete and we can go from there. And I'm happy to answer any questions that anyone might have.
Thank you for that. That's a lot to take in. And I just want to try to summarize and clarify what we're being tasked with here. We can choose to just adopt the state regulation and call it a day.
Yep.
Right. We can modify our 2014 regulation to come up to date with the changes in definitions and fines, etc. So it would have a little bit of a hybrid approach with our local regulations brought up to some of the standards of the state, or we can just ignore the state, not ignore the state, because that you're saying supersedes, right? The state law supersedes local.
Yes. Yes.
So
because you can't be less strict than the state. And right now, some of your regulations are less strict than the state.
But what we could do is make some of them more strict.
Yeah, you could. You could make some of them more strict.
Or we can just leave it at this. So I guess one of the questions was whether, if we are going to move forward in any way, whether we need to have a public hearing again on this. Is that right?
Here's what we've been telling municipalities. If your goal is just to incorporate the state law into your local regulation, that's already the law you have to enforce. So you would not, number one, I should back up. Legally, a Board of Health does not have to hold a public hearing unless they're addressing a Title V septic and sewer issue. That by law, you have to hold a public hearing. There is no legal requirement for a public hearing for any other regulation that you might be considering. However, I don't know how one would ever get public support if you don't give the public an opportunity to be heard. So best practice is always to hold a public hearing. Having said that, if you're adopting a regulation that's already the law that needs to be complied with, you're not proposing anything that these retailers and that your municipality has to comply with over and above what the state law already says. So not holding a public hearing would be perfectly, first of all, it's legal. Second of all, it would be fine because, in my opinion, because you're not subjecting anyone to a law that they have no notice of. So I would say you would not. If you're just incorporating the state law, number one, there is no legal requirement for hearing. Number two, it doesn't need to be, folks don't need to voice their opinion because it's already the law.
Right. And
if you were adding new strategies, for instance, if you wanted to unify the fining structure, I would suggest holding a public hearing because that does affect retailers. Their fines go for some offenses from $100 for the first offense to $1,000. So that would be, if you're going to consider doing that, or adding, a ban on smoking bars, you don't have any. But if you're looking at the capping process, which is not in your current reg, then those are strategies that I would suggest a public hearing would be a really good idea, even though there's not a legal requirement.
But what does it, since we did hold public hearings in 2019, where much of this information was heard by those existing license holders, I don't believe there's any new license holders. Does that satisfy?
I
Well,
thought-
there, again, there isn't a legal requirement, so
Right.
it's really up to what you think is a best practice. I would submit that, number one, I don't know whether your retailers have changed hands, whether the management is different or not in some of those retailers. Karen is saying no, but a fining structure, I think would warrant a public hearing if you wanted to change that. And I would, you know, in an abundance of caution, anything that was local that is not in your current regulation, even though you did hold hearings years ago, I would suggest holding another hearing. We had this situation come up in a municipality, gosh, probably 10 years ago, and they enacted a regulation based upon a public hearing that had been closed for a few years, and it did not sit well with the town attorney or with the public. So they ended up rescinding it. So it's totally up to you, but a hearing that was held 2 years ago, you should speak with your town attorney about
Yeah,
that.
well, even without talking to town attorney Jill, I think
Just talk to Mark.
well, I think if we're gonna do something, we should do a public hearing. It was a long time ago. We also have, you know, majority turnover on the Board of Health, right? I mean, Kurt and Randy haven't, you know, thought about these things. They may have different views than what our views were at the time. And also, I think our regulation that we were thinking about at the time, I mean, a lot of what we were thinking about did get addressed by the state, which then creates some confusion if we just sort of piggybacked off of hearings we did before, right? Like we hadn't actually finalized what we were gonna do, but we definitely were gonna do, you know, mint and menthol, and now the state has done that. So like, that's an easy one, right? And we had thought about, should we put a cap and have it sort of go down over time, even if it was like to 10 or 8 or something. But, you know, at least in my mind, I don't feel like we were saying we're going to eliminate all
Right.
establishments over time, but we were saying, let's not have it grow. Let's
Right.
have it, you know, everyone who already has a business, we're not going to take it away from them. But,
That's what
you know, let's have it, you know, let's think about what's the right number over time, to the extent that things get retired and things like that. So, and we were at the time, just as background for the new members of the board, I mean, we were really worried at the time about, you know, cigarette usage on its own. There had been so much progress and decline over the years, but vaping was this like massive epidemic in the schools. And that was really what got us all sort of focused on this. And that's part of why the flavors, and, you know, because flavors are the things that, you know, underage consumers generally use. It becomes kind of the gateway and stuff like that. So anyway, there's just some background, but I think given a new, you know, 3 new people out of 5, I think we kind of have to start the process over again.
No, I would agree with that. Marissa?
Just have a quick question. So when the fines are 1,000, 2,000, 5,000, and we're talking about suspensions of their tobacco license for up to 30 days for the first one, and it goes all the way 7 to 30 days, even for the 5,000. Is that something that we would hold a public hearing and get feedback on that, or is that something that?
No, that's already the only one that that the 1,000, 2,000, 5,000 are mandated state fines. The suspensions, the way that's written in the state law, the suspension can be, there's a for the sale to someone under 21, the board can determine, and that's a mandatory suspension for the first offense for selling to someone under 21. But the board can choose between not less than 1 to not more than 30 days for that suspension. That's a decision that the board makes.
So,
And it's in this proposal. It's in this proposed regulation. The board would determine. I can tell you most boards are doing between 1 and 3 days for that. And the reason they're doing that is because for a second offense, Normally, what a board does is use the 7 days. And you can use the 7 days, or you can be stricter for a second offense if you want to be, but the 7 is the minimum.
So
And then for the third offense, then this is pursuant to state law. For the third offense, the minimum is 30 days, and you can go higher if you want to go higher. But you can't go less.
So where we're coming from with this, Cheryl, is we had, Marissa has a violation of an establishment for an under 21 sale.
Yeah.
That we're, so what we're trying to work out between the two of us today is what's the permit suspension? Because there's no number here for us to
Right.
go by. So is that
There's no,
something?
right, there's no number here, and this, depending on how you go, you're either going to want to hold a hearing or not a hearing. What the board can do before this regulation is enacted is the board can vote, even tonight, the board can vote on how many days they want that suspension to be for. And it could be effective tonight. You could vote right now if you wanted to address just that piece of this.
We definitely need an answer tonight, I would
Right.
say. We need to get
Because-
this information out to the retailer.
Can I ask a question, Cheryl? I thought
Sure.
that if it's in the state law trumps what we have. So why?
Because the state law says, believe it or not, that the suspension can be not less than 1 or more, and not more than 30 days.
So the board has to pick a day for this
Correct. They
particular,
have to pick
even
a
if it's
number of
just for this, and they could revisit and change their mind.
Yeah,
for the public
Yeah, but
hearing.
you would need, and it's between 1 and 3 days is what municipalities are doing.
And I just want to weigh in on equity too, because we want to be really careful about going back and forth with, I think that in some ways it's better to just say, and Cheryl, you might have a different stance on this and feel free to tell me. But just so I've seen other retailers talk about, if they ask someone for their ID, that there have been some outbursts because they felt like people were saying they were being discriminated against due to their race. So just not
For
to get
asking
into
for
all
the
of that.
ID.
Hmm.
for
Yeah,
asking for-
so we don't really know how people think. So I'm just saying that maybe we should pick a day, like an amount that's set for, all of them, or maybe we can just.
Oh,
maybe we can
definitely, you definitely want to set a determined number of days.
For all of them, yeah.
Yeah.
For all of them, yeah.
Oh, well, correct, in the that's why, but it's still your decision to pick how many days you want.
Oh, yeah,
But-
but if somebody comes in and gets just say a 1 day,
Oh, no, that you need a consistent,
Would be
Okay.
the-
it needs to
That's
be
perfect.
consistent across the board for anyone who sells
Yep.
to someone under 21.
Good.
And for the other suspensions as well.
What I meant by what I said was the board could vote tonight on a specific date.
Yes.
A day, number of days,
Yes,
and then if it so chose during our public hearing, you changed your mind and you wanted, at that point, everyone is notified again. The
right.
board could say, instead of 1 day, it would be 3 days, moving from that point forward, adopting the state regulation.
You could do that, and it would be understandable as long as, you're voting tonight because you have a reason to vote tonight because you have a retailer. But when you're looking at your regulation long-term, you may change your mind. But again, it would be that number moving forward for everyone.
Yeah.
And
Yeah,
Cheryl,
okay.
just, can you please clarify, it's also to determine whether or not we would have a hearing for a permit suspension or not?
If you are suspending a permit is a privilege, it is not a right. However, with that permit comes a due process right for notice and opportunity to be heard. So you cannot suspend a permit without violating someone's due process right, without providing them the opportunity to be heard. They may not want to be heard, they may waive that right, but they have the right before a permit is suspended to present their side of the story.
Is that 7 days for written appeal?
Normally, that's what we put in a cease and desist order.
Okay. So they
Just,
have
you put in the template, and we have created the templates that you have the right to appeal this to the Board of Health, do so in writing before, at this address, before this date. We put that's right in what Marissa issues.
And Melanie, that's what I was working off of, the template.
Okay, sounds good.
Okay, so to recap, we have a couple of decisions we have to decide tonight. We need to decide tonight what to do about this current suspension issue. We also need to decide whether it sounds like we need to have another public hearing, whether or not that's to adopt the state regulations or whether we want to modify the current Concord regulations to be updated to incorporate some of the state information, but to go a little bit above and beyond in some cases. So we have to decide those two things, whether we want to just stick with update the current 2014 regulations with some specifics to Concord, or just wholesale adopt the state regulations. Either way, it would be fair to the community to hold another public hearing, letting them know what we're doing. And
I think if you're, I'm sorry to interrupt, but if you're just adopting the state regulation, you don't need to hold a public hearing.
But I thought I heard you say that because the fine structure is so different.
What you would be no, the fine structure is the fine structure for the 1,000, 2,000, 5,000. However, if you want to apply that fining structure to your local strategies, for instance, if you want to apply it to your cigar packaging, you should hold a public hearing, because that would be an increase in the fine that's currently assessed.
If we're just adopting the state, we can just adopt the state.
Adopt the state.
We're okay with that. If we want to modify with some of that, we need to inform the public. Okay. Prior to getting into further discussion or debate about what we want to do, I just want to give you guys a little bit other additional background for what it's worth. I went into the most recent youth risk behavior survey, and for our new members, this is a survey that's done about every 2 years with 6th, 8th, 10th, and 12th graders. There's an aggregate study that's done within, it's actually part of Emerson Hospital's community benefits program to sponsor these youth risk behavior surveys, which are based on CDC and state survey tools. They're modified and adapted to local questions and concerns. And these provide good trend data over time for all sorts of behaviors. The most recent YRBS did actually do a lot of changes in their questioning, but then the document does note changes in it. But anyway, what was most relevant to me is I went and I looked at what I could about e-cigarette use or vaping it's at the high school. And of respondents in the level of e-cigarette use or vaping at the high school was down to 6% of respondents, and the total number of respondents was about 700 kids. In 2018, it was at 23% had vaped or used e-cigarettes within a 30-day period, in the previous 30-day period. So 23% in 2018. That went down to 12% in 2020, and in 2022, it's down to 6%. So there's actually been real success, I think, in the work that's been done nationally. It's not just locally, in reducing access to e-cigarettes, flavored tobaccos, and all of that. So there's really been successes here, and we're on the right path. I thought that was just important background use. That it was also, in the most recent study, it said that 2% had used e-cigarettes for at least 10 days in the month before the survey, 2%. It actually came to about 13 students within the high school population. So that's the end. So just to have some perspective, and I'm not saying that we shouldn't be adopting strict regulations. I just thought that it's just important to know what we're working towards here.
Could
Go
I
ahead,
ask
Kurt.
2 questions?
Sure.
When did the state regulations go into effect? And then how have other communities responded to the state regulations? Meaning, did they see the need to implement more stringent regulations, or more or less accept the state regulations as baseline?
Those are 2 good questions. The state law went into effect in 2020.
It was
June of 20. Yeah. The problem is that COVID has confounded everything, because they went into effect, but there was no enforcement because no one was out in the stores. So trying to get any good data now on youth use is really difficult because kids weren't in school. So we're hearing anecdotally from our programs that this is a much bigger problem than we may think it is, because we weren't able to capture the data that we needed to capture for the past couple of years. We're also having a real issue with vaping products that contain non-nicotine substances. And those products that are flavored, that contain non-nicotine flavored substances, are captured by this state law. So all of the synthetic THC stuff that's out there, like the Delta 8, the Delta 10, all those are prohibited if they're flavored. And they're all flavored. So that's another issue we're having. The state law went really far. I mean, it went further than we thought it would in the strategies that they've adopted, especially with these fines. So there aren't that many local strategies that go beyond the state law, as was just mentioned. The one that has the most traction, or a few, banning blunt wraps, which you already do, and the capping process, the density strategies. Those are the ones that, if a municipality is looking, those are the ones they're looking to pass. And I would say it's 50-50. I just had a Bedford Board of Health hearing where they just enacted the state law and some of the strategies that they had that were local, like the cigar packaging, but they didn't adapt. They had already adopted the capping, just the basic cap. So it's really, I would say half and half. Half municipalities are being stricter and half are not. They're just adopting the state law. Because the state law is really good. I mean, it's strict. I mean, they really.
Yeah, I appreciate what you said about, the data is hard to really trust at this point because it's been so hard to really capture. There were actually other flaws I saw with the YRBS that made me question a lot.
And plus we know that the mental health issues are really prevalent right now in schools. And that's why some of our programs that are out in the field, that's why they're seeing the vaping that they're seeing and what they're hearing. And they think it's tied to mental health. I mean, and again, this is conjecture, this isn't.
Right.
But that's what they're telling me. I'm not out in the field.
I'm out in the field. Can I add one thing to this?
Yeah.
So some of the numbers I think are affected, of course, from COVID, and some of them they've transferred over into other products. There's nicotine water, there's Zyn pouches. So these Zyn pouches are like powdered nicotine, and you can't even see when somebody's using it. I have a kid in high school. I mean, they're using it in class and the teachers don't even know. On the field, the football players are slicing their toes and sticking that nicotine in their toes. I mean, there's a lot of other things going on, unfortunately. And part of updating the regulations, the local regulations, maybe at some point we could talk deeper about products like Zyn, because we don't regulate the nicotine content. So they could still be getting more nicotine. We have no idea how often they're even using it, because they can stick it in their mouth, they can stick it in the water, they can do anything, stick it in their toes.
Wow.
2 questions. Do you foresee generating new
Dr.
that might
Crane,
be more?
Dr. Crane, we can't hear you very
Yeah, you're
well.
breaking up.
How
Maybe if
about,
you could
how about
do
now?
a little bit better,
Better? Okay.
little bit.
Do you think the state would enact future regulation in the future? And
We can't
me?
hear you, Dr. Crane. Can you put your video off and maybe it would get better?
yeah. Right. How about now? Does that help
Much
at all?
better.
Perfect.
Much
Yep.
better.
Oh, great.
Yes.
Okay. All right. Excellent. Does the would you anticipate the state making stricter tobacco regulations at any in the future? I mean, it's hard to conjecture, I suppose. And then the secondary question would be, what's the process involved with the public hearing? It sounds like could potentially be quite a process, but would that be? Are we talking several months or longer, or and how involved is that process?
It really doesn't have to be that involved. Number one, because the state law is so strict, we don't see a lot of opposition to these newer strategies. The public hearings they're not the way they used to be. So, and the process is pretty simple. I can send over a really good instruction sheet on what to do, but it's basically to put a notice in the local newspaper for 2 consecutive weeks. And then you hold the public hearing, and then the board either votes that night or they can vote at the next regularly scheduled meeting. So unless, there's some unforeseen objection to a capping strategy, I don't think you're going to get a lot of opposition to this. That's been my experience, that it has not been, it's not like it was 2-3 years ago when this was done and it was very heated. It's not like that at all. And then your second question, is the state looking at any other tobacco laws in the near future? I would, the one that they are looking at, that there's a bill that has already been filed, is to look at raising the excise tax again. As to public health strategies other than raising the excise tax, I don't foresee it in the next 2 legislative sessions at all. There will be some amendments to try to weaken the current state law. We always get bills filed that would, try to roll back the flavor ban, roll back many of the fines. We'll see those bills getting filed, but not proactive tobacco laws, not in the near future.
Right.
So if we wanted to enact, would kind of be good opportunities.
It would now be a good time, yeah. Especially if although the legislature has not had any appetite for rolling back this law. Every legislative session, a bill gets filed and it gets sent to committee, it gets sent to study, which means it basically dies. So I don't anticipate that procedure will change.
Mark, did you have a question?
Well, I was just going to say, I mean, I think that's a good reason why I think at the very least we should adopt the state standard, so that if something does change in the future, then the Board of Health has an opportunity. Concord doesn't change unless we make a different decision, right? So, because a lot of what the state did is the stuff that we were thinking about doing at the time, and if we won't have news cameras at this public hearing, that would be good, because we did for the other one. So
no, you won't have news cameras.
good.
Yeah, enough of that. In the interest of time, I'm thinking I want to move this a little bit further. I'm wondering if there's a proposal I kind of heard to, at this point, I'm wondering if we should adopt the state regulations, but continue our conversation at a subsequent meeting about whether or not we do want to take it any further. At that point, we can then decide. If we decide to do so, we can then hold that public hearing as necessary. Is that a reasonable approach?
That would
Yeah.
be easy for me to draft. I can just take what we've done and take out all of the new local stuff, leave the
Mhm.
stuff you already have, take out the new local proposals, and you can just vote on it at your next meeting.
Mhm. And then continue the conversation about whether we want to take it further.
Whether you want to do the capping or the unified fining structure, those pieces.
Right, and secondary, well, the tertiary to all of this is we do need to come up with the suspension decision tonight as well. But that's separate from what we do now about the regulations. Comments, idea, I mean, thoughts about that proposal, about whether to adopt?
My reaction is it sounds like a reasonable approach to look towards adopting the state regulations as an initial step and then contemplate additional regulations that reflect where we are right now in 2023, which may be beyond what was contemplated in 2019.
Right. Okay, so then do I have a proposal? Or a Mark, you're good at this.
Well, but I mean, I think
I'm confused.
I think that I think Cheryl is still gonna write for us the amendments that would do just that limited scope of amendment. So I don't think I think there's consensus. I mean, I'm certainly fine with this approach, but I think the consensus is Cheryl will write us an amendment that just adds the state criteria. We will vote on it next meeting, and then we can separately discuss at the next meeting if someone feels we should pursue a public hearing to make other changes or not. So I don't think we have to vote on that now. It would be a vote next meeting.
Yeah,
So Cheryl's going to is going to incorporate.
just the state, just what I
Just
did
the
for
state-
Medford today. I'm just going to
Okay, just the
incorporate.
state stuff that's not in our current regulation. You're going to do that. It has nothing
Which
to
will
do with the
include-
previous, it has nothing to do with the previous one. That's just like out in the wind.
That's.
The
forgot, that's
2019
all-
one is out in the wind. Okay,
Exactly,
so we don't have to, that public hearing is done and over with. This is
exactly.
Brand new.
That's old news.
Okay, old news. Okay.
Public,
So-
but it's old.
So is it
So,
taking the
yeah,
2014, takes the 2014 regulation and updates it to the 2020 state regulations?
Correct.
Okay.
With the definitions that are in the state law, all of the stuff that's just in the state law.
Okay,
And they're already familiar with it because that's what's being enforced, which is what
Exactly.
we've been talking about,
Exactly.
Melanie. Oh, anyway, state always trumps local unless local makes it more stringent.
Correct.
Yeah.
okay, great.
Okay.
All right, so we're good on that with what to do with the big picture for now. We will come back to this in February. We'll have the updated to review.
Yep.
Okay, and approve it at that point.
Well, you would vote to enact it.
Yes, that's what I meant. Shouldn't assume, yes. Marissa?
Cheryl, can I ask you a question? When we
Sure.
talk about we have to go with the stricter policy, what if, I get confused with, we'll just say cigar pricing, for instance. So I have a town that doesn't regulate cigar pricing. So their cigar pricing is way lower than the state.
No, the state, that's not a state law. The cigar pricing is not in the state law.
Oh, okay, okay.
That's why you can that's a local strategy. The state didn't have it, and the state doesn't have any real requirements on tobacco sales permits either. Those are local.
So when the state talks about bringing it up to just say 580 or whatever it is.
That's not the state, that's us. That-
Oh, okay.
That's strategies that have been enacted by boards of health based upon recommendations from the TA providers, the legal education providers, and they're recommended by the Department of Public Health, but they're not state laws.
Yeah. Okay, so I think someone misunderstood me when I asked months ago when I was brand new. So that's why I've been confused about that, but good to know. I'm glad I asked.
Okay, and we, Marissa, you and I can have a one-on-one and go through
Yeah,
these issues, because
Okay.
they are confusing.
yeah. Thank you.
I want to get back to the issue of the suspension timing, because we need to give you an answer on that tonight. In the regulation, it was, what was it? It was 1 to 30 days.
Yes.
Excuse me, up to 30 consecutive business days. And we get to choose a specific day duration between 1 to 30 days.
The third 30 days would be for a third offense, Jill, in the state.
No,
right?
but this is the way the
Yeah.
state law reads.
Oh, I
the
see,
First
I see.
offense.
In the
Okay,
case of a first violation, a fine of $1,000 shall be issued. And additionally, if the violation is a sale of a tobacco product to a person under the age of 21, the
okay.
tobacco sales permit shall be suspended per 105 CMR. And this is where the local Board of Health decision is either up to 30 consecutive business days or choose a specific day duration between 1 and 30. So in the second violation, within 36 months of the date, the fine goes up to $2,000.
And you have 1 to 7 days.
Right.
I misspoke on that. It's you have up from, or you can be stricter than the 7 days.
Uh-huh. So then in the case of 3 violations, it goes from 7 to 30 or more. And
Right.
4 violations, they're permanently revoked.
Yeah, and if you look at our existing 2014 regulation, we don't have, we have lower dollars, but we don't have a suspension for the first violation, but we have up to 7 days for a second and up to 30 days for a third. And so, you know, absent a change to that regulation, which we haven't done, I mean, those two are consistent with the state. It's just the first one that, you know, we're being looser. And so to me, it feels like it should be something less than the 7 days, since we've already told retailers they're on notice that, you know, a second violation is going to be 7 days. So it doesn't seem right to charge them, you know, more for a first violation. Again, this is something we could always change if we decide to take up a public hearing and do a different thing. But I think really our choice should be somewhere between 1 and 7, not more than that, given that we have a 7 for a second violation.
Right, and the current 2014 has none. So
Well, right, but and again, it's only the
Right.
state law is only for selling to someone under 21 for a first offense.
Yeah.
Requiring a suspension.
so
Right, we have to do at least 1 based on the state law.
Yeah.
so it would, you know, I guess the purpose of this is to make it where there's some pain, right? But not, you know, but I guess, you know, you want to be reasonable as well. So is 1 day going to do much? I don't know.
Should I propose 3 days? That was the kind of upper limit of what the kind of recommendation was, right? Is that correct, Cheryl?
Yes, that's what most municipalities are doing, between 1 and 3. I haven't seen anyone go over 3
For a first violation.
for the first violation for a sale to someone under 21.
I like that.
Yeah, it feels like it will have an impact. You know, it 1 day doesn't feel like they'll even notice, you know, but 3, when they're turning away customers, will feel some pain. So then do we need to have a proposal?
Definitely have
I
to
would
make
just
a
take a
motion.
vote.
Yeah,
Yeah. So, but I guess, sorry, just to ask this, Cheryl, do we take a vote and then they get notice and then they can appeal to the Board of Health? Or do we have to tell them? do we have to
No,
have
you're
an agreement with them?
you're voting on the number of days of a suspension. I don't see that they still have a right to come in and appeal the suspension. It's not an automatic suspension. So when Marissa notifies them that the board voted the suspension is 3 days, you have a right to appeal. And they can't appeal the number of days because that's what you voted. But because you're suspending their permit, it's not automatic. So they
Okay.
could still appeal it, but you're not going to change the number of days. You voted 3 days.
And
So
that's,
it's not something where you go in and they get the notification that their license is suspended and it's in effect right then and there?
It can't be in effect unless they waive their right to, they could waive their right to a hearing. They just have to be given notice and opportunity to be heard. They may, and most of them do waive it because they've already admitted that they did it and they know it's a mandatory suspension and they just serve the suspension and they like to get it over with. But they do need to be notified that they have a right to appeal it because it's a suspension of a permit.
that's
And
pretty
how does it
routine.
get monitored? How do we know that they're abiding by that suspension?
Normally Marissa,
Well, I send kids in again for compliance checks.
Mhm.
There was a place, I don't want to say the name, but somebody didn't keep up their Department of Revenue permit. And I went in there and they said, oh, I can't find it, the whole story. And eventually I found out that they didn't have it, it was expired. So I told them they had to take all the products and put it in the back. And then I went the next day and I had a youth go in and they weren't selling anything. But then when I went another couple of weeks later, I still had a youth check in again with that store and they still weren't selling. So I'll have people go in, do checks.
So when the permit is suspended, we make them take everything off the shelf.
right?
They have to completely remove it and we verify that.
Mhm. Okay.
I mean, we can't be there
But that's
whole
not
time.
immediate. It's after you.
after it's been,
After they've been
and
given
after
notice
they
and
give a
opportunity to be heard.
notice, right?
and it's,
correct.
this is the date, and then we go and they have to pull it, put it all away.
Okay.
That's part of the process.
Got it. Okay, well, in the interest of time, I think we need to take a vote on this. And the,
All right, well, I'll move that the Board of Health adopt a policy of suspending the permit for 3 consecutive business days in the case of a first violation of a sale to someone under 21.
is there a second? I'll second it. And
Yeah.
all in favor, Melanie, you have something to say?
Is it business days? Because weekend selling days. Oh, it's business.
That's a
days?
business day for them.
Okay,
Yeah, if they're open,
all right, cool.
right, then it's a business day. I mean, that's the rules all say consecutive business days.
That's fine. I thought it meant making sure it didn't just meet Monday through Friday.
All in favor? Aye. Okay, I,
Yes.
well, Marissa, you're not voting, thank you though. Okay, great, so thank you.
Jill,
We've-
sorry, Jill, just
So we're
to,
gonna do a roll.
I think we have to do roll call.
We have to do
Oh,
a
we
roll
do,
call.
we do. I'm sorry, yes, okay, can you just say the motion again, Mark?
Oh, I'd have to say the motion again. You just have to do a roll call.
Okay, okay, we're voting on a 3-day suspension for 7 business, three consecutive.
Yeah,
business
3
days.
consecutive business days for a first violation of sales to someone under 21.
Okay, thank you. Okay, Randy? And how do you vote? Okay,
In favor.
in favor, Kurt?
I also vote in favor.
Okay, Mark?
I vote in favor.
And Jill, I approve as well. Okay, thank you. We have a fine, or we have a suspension. We have a plan for moving forward a little bit. So maybe by June of 2023, we will be,
You'll be all set.
Okay. I think we're done then with discussion of current tobacco regulations. Marissa, do you need anything else from us at this point? Cheryl, do you need anything from us now?
No, I have my marching orders.
Thank you, Cheryl.
Thank you both
No
for
problem.
all of your input and for your help on this and
No
the time.
problem.
Okay.
Thank you.
Okay.
Thank you.
Much.
Thank you.
Bye.
Okay. All right, this will be fun moving forward. I mean, those public hearings I have all of my notes from 2019, and there were some passionate voices that were in there. Maybe there'll be a little less, but there were also passionate voices that were totally in support of doing more. So it's important to keep that in mind as well. Moving on to agenda item number 5, board member reports. I just want to share that this morning I attended a breakfast meeting from the Concord the Concord Climate Action Network on PFAS chemicals, and this is serving as a heads up. I don't know the details yet, but I believe that in this year's town meeting warrant, there's going to be discussion about renewal or replacement of the turf fields up at the high school. There's a current moratorium on new installation of turf fields on private property, but not on public property. So Mark probably remembers this, I'm sure Karen does as well. When the turf fields were put in, I guess it's probably 10 years ago or so at this point, it was pretty contentious. And this PFAS hearing, informative session this morning really spoke a lot about the level of PFAS in turf fields, not just in the crumb rubber, which is one of the components of it, but in every level, every ingredient basically of turf, PFAS were heavily present. And I think even in the years since the field was installed, I think there's been more information available about it. And I think there's going to be, they're going to be looking to the Board of Health for a lot of guidance on this. So just a heads up, I think we're going to be, very much in the limelight on this one. And I think, Kurt, I'm really glad that you're here for this, because I think that this might be something where your expertise will be helpful. I think there'll be more about it. The person that was speaking was also talking about just a lot about what could be done in terms of water filtration, and certainly public works will come into play in that, and Melanie was part of a discussion with our public works director recently about this. So it's certainly on their, they're aware of this issue as well, but I think there's going to be a lot of discussion in town on it, and we're going to need to really have a good understanding of it. What else? Does anybody else have, anything to report on things that you've been working on doing that you're seeing? I don't know, Randy, if you're seeing, any changes lately in COVID or other, infection or issues in the hospital that kind of are new to the radar, or anything?
Biggest thing, and let me know if you can hear me or not. I'll leave my video on for now, but is mental health. It's great to hear that that there's a move to address that in the town, because the amount of mental health seen in the Emerson Emergency Department is extraordinary. I'd say even more of an undoubtedly more of an issue currently than COVID. So and in addition to other respiratory illnesses, really, I mean, there's seasonal variation, of course. So depending on the month, you may see more or less respiratory viruses, but that's always been the case. And I think mental health is certainly hitting a peak at this point. So I'm glad to hear again that the board that we're looking at that.
Oh yeah, doesn't go away. And I'd actually, in your packets, we included, just for your background, the annual reports, that one that I wrote and then one Melanie wrote about the activity on the board, and as well as what the department has been dealing with. Those get compiled for every department in the town, but I shared them with you all so that it was just a reminder of some of the things we've been dealing with, and mental health is part of that. Certainly, it's an issue that comes up in a lot of other discussions, and it's going to be one that's coming up that Melanie and I are going to be part of next week. Melanie, why don't you give us an update on what's going on, and you can share what's going on with that.
Yeah, so I've been here about 8 months, almost 9, Kurt and Randy. And as part of my initial get to know town people, I did a lot of discussions with group about different stakeholders about what they want, what they need, what could the Board of Health do. And mental health came across pretty systematically. Police, fire, the Council on Aging, everybody pretty much told me, the school department, this is our biggest concern. When I put in our budget request for public health nurse, and I cited mental health as one of the reasons I wanted a full-time public health nurse. I was told by the budget committee, yeah, everybody's saying the same thing. So what we decided, I emailed in your packet, is the memo that I sent to the town manager, essentially saying, hey, I've talked to everybody in town that my local, partners within the government, not everybody in town, but are, and I want to try to get a working group together to at least start talking what we can do. And then from there, what will work, and Jill's been working with me on our group next Monday. We're going to have a meeting of just right now municipal stakeholders to talk about public health, what they do, what they have for programs on mental health, substance use, what people's needs are, what their ideas are, and try to get some ideas for our opioid settlement funds. So I've been working with Chris Carmody in the town manager's office on what we're going to do we get Board of Health is going to determine what we spend that money on. So what the best path forward would be. Did you want to add more to that?
I'd say that, we know from the Emerson Hospital Community Health Assessment, we know from the Youth Risk Behavior Survey, and we know from the Healthy Concord planning process that took place almost 10 years ago that mental health has been high on that list. And it's not just for youth, it's for senior citizens as well. It's for everybody. So we know it's a national problem. So we'll see what we can do locally. But I'm excited to work with Melanie on this. And I think it's as you all are out and about in your lives as residents of the community, it's just it's always interesting to ask people what they think are some of the public health concerns. When we did the Healthy Concord project years ago, which was a planning project, I would be on the soccer fields and I'd say, so what do you think would make Concord a healthier place to live and work? And it was always interesting to see where that conversation took us. And I just encourage you to have that conversation as you go about your lives here, to start getting ideas for really where people's minds are at.
Yeah, and please share.
Yeah.
So the other part, I just wanted to kind of give a quick update of what we've been doing the rest of our time. This end of December, all our person permits, so our haulers, installers, the inspectors, all those expired. So we've been working to renew those. You saw the annual report that we prepared and submitted. We're also working on our budget narrative. We did have to submit a budget for FY24, and now I have to continue to explain what we did and what we're going to spend money on. The on-site wastewater disposal revision number 2 for the middle school was submitted to our office on December 21st. We have reviewed it and we are finalizing our comments to go back to the niche engineering, the engineer for the school department chose. It will not be approved. There is a considerable list of concerns that we still have. We are working, our new inspector, Mike Fanoli, is working, he's done this, he's doing his food training. So he's working on the FDA retail program standards for food safety on the online and a couple in-person trainings for that. Karen worked hard in the last month with us on our nursing contract. So Emerson Home Care suspended their permit effective November 4th. We've had support from the Great Meadows Collaborative nurses to cover our disease monitoring through Maven. But that's pretty short. 5 hours a week gets us barely calling the 65 and over COVID cases and doing any kind of disease follow-up for foodborne illness or any other tick-borne diseases or anything. So we secured a contract to hire somebody an additional 5 hours a week. So we have a total of 10 hours of public health nursing, which is still not great, but it's better than none. So we're working with it. Also, Karen worked hard. We did a proposal to the town manager's office to raise our weights and measures fees. I think we talked about that last month, but we contract with the state to do all our scales and And they doubled their price, their cost to us, so we also doubled our fees to match. We're not making money, we're not legally able to make a profit, but we are going to mostly break even. That's the goal for the town. And finally, the end of December, Gabby finished the 80 animal inspections for the barn book and submitted that to the state. Any questions?
Did you say the barn book?
It's called the barn book. Yep.
Sweet. So
This
it's
is
a list of all the
old
animals?
yeah, it's about all the domestic farm animals. So it's a state requirement that we have one animal inspector, which is Gabrielle. And annually we do an inspection of all those barns and give a count of how many chickens and how many horses. I don't have the total numbers for you, but
There are a lot.
retail this, huh?
I said there are a lot in Concord.
There are. That
A
was
lot
really
of chickens
surprising.
roaming around Concord.
A lot of chickens, horses, other horses or donkeys and
Donkeys.
pigs.
there-
I didn't know people had pigs in Concord.
Oh, there used to be a kangaroo.
Yeah, on Garfield Road.
So,
The name of the kangaroo.
Yep, she sure
That-
did.
Yep. that was submitted and is wrapping up, and now we're looking forward. We're going to be working on the website and kind of renovating. Not really the right word, but
Revamping.
revamping our website because we know it's fairly outdated. We want to, that's one of our goals for this year.
Great. Thank you. Any questions for Melanie? Okay, thank you. I want to move on to the board calendar. We've talked a lot about going back to meeting in person. I really hope to be back in person by now. And I'm actually on day 9 of COVID. So I'm really happy that we're not in person because I wouldn't be in the same room with you very comfortably at the moment. So there's definitely a reason for keeping things virtual. On the other hand, I was at a hybrid meeting this morning and it was just so complicated in terms of sound quality and communication. And I don't love hybrid meetings also, but I think that there's some value. Certainly when we do, I think if we're at a point where we have to hold a public meeting on tobacco, I think we'll have to think seriously about how we do that. I think we most likely will do it in public, but nevertheless, in your packet, you did have the meeting calendar, and I just want to see if, make sure with our newest members and everybody here that we are available on the subsequent dates. Our next meeting was already moved to February 15th. We're normally the third Tuesday of the month, but it's the second Tuesday of the month. I guess it's third, but we are meeting, our next scheduled meeting is 8 a.m. on February 15th, which is a Wednesday. Is everybody available for that?
I unfortunately am not available. I would be available if it was in the evening, but I'm not available that morning. I'm already scheduled to work, unfortunately.
Okay, no, that's why we ask. And we have to see whether Jim is, but I imagine, and Mark, is that school vacation week? Is that why we had moved it?
The 21st.
Yeah,
was school
the
day.
following week is, the February and April dates that got moved are because of school vacation weeks.
Okay. So I think for now, we'll keep it on the 15th. Dr. Kring, you might not, well, we will recognize if you can't be with us. We'll have to check with Jim Whalen to make
Yeah,
sure.
Jim had an unexpected thing come up. That's why he's not here tonight. So
Yeah,
I'm
I can
sorry.
certainly do the evening on the 15th if others can. If that gets Randy available.
I may also have a conflict on the 15th. It's not crystallized yet, but I may need to be traveling for work.
And would that be, okay, so it doesn't matter whether it's morning or evening.
Correct.
Okay, so we might need to come back to that. I mean, I think what we'll do, does it make sense, Karen, to keep it scheduled for the morning of the 15th currently, but if we don't have a quorum?
well, yes, I mean, I would keep it. we need 3 people for a quorum.
Mhm.
But the reason why it's on a Wednesday and not is because I was trying to find places, like even to do it hybrid, I need a computer.
Okay,
If it's hybrid, we have to be someone has to be in that room running that computer. And
Right.
I was working around other meetings that are already, I couldn't get the nighttime on that
Right.
day. That's why.
Right, so if we know we're gonna do it, if we do it, but if we decide to do it by Zoom, you have more flexibility to find other.
If we do it by Zoom, then we're all right where we're at right now, and it's definitely more flexible. Not for 8 AM necessarily, but well, yes, at 8 AM, we could be in our office.
okay.
So I would suggest keeping it.
Mhm.
That's my suggestion, because that was the date. The 21st is the following week, and then the week after, you're at the end of February.
So let's keep it currently at 8 AM and do a hybrid. And we'll see how that works. We might end up changing it based on whether we have a quorum or not. But for now, we're going to leave it as that. The March meeting on the 21st, I actually can't be there. So that one's out for me. I'll be out of the country. So I don't know whether you want to find another date or whether you want to do it without me.
Well, I have a lot of vacation going on. I might not be able to be there, but Melanie will be. At the beginning of the month and at the end of the month, I'm not going to be at 141 Kais Road.
She says with a big smile.
But I could find another day. If
we move it to the Mark,
how long?
I was gonna say, there's no reason not to try to find another day. I mean,
Yeah.
ideally, when we have conflicts, if we can find a different day, we should move them.
Yeah.
What is your?
I'm out of the country from the 19th through the 27th. So, so the prior week would be better for me. Maybe the 14th.
Well, I don't have to be there, but I'll work on getting a day. Yeah.
Okay. So maybe March 14th.
Yeah, I have to look tomorrow, Jill. I don't have the calendar.
But you'll send us some options.
Yeah.
Okay, thank you. Any other, I mean, I have no other conflicts that I'm aware of at this point. I don't know if anybody else does. April, May, June. Just we often don't meet in the summer. I'm not saying that we can. We certainly, if there's agenda items, we will, but oftentimes we end up having a lot of missed meetings in the summer. Nobody seems to ever mind.
Especially in August, that seems to be the month that we don't.
Right. So, okay.
General thought, one general.
You're breaking up.
Dr. Krang.
Okay. How about now? Can you hear me?
Yep. There you go.
Yes. Okay. One thought would be, instead of doing hybrid meetings, if we did like every other meeting as an in-person meeting, or or once or twice a year in person, and then the remainder is Zoom. That might kind of have us all be together at some time without having to deal with the technical issues of hybrid meetings, and allowing use of Zoom for the other month. I don't know what you all would think of that, but
I appreciate that. I like that idea. I mean, we used to always be in person, and I just think that it's nice for group cohesion and, getting to know another, and it's just sometimes easier to facilitate. So, so I would like to resume in-person meetings. It's been a while. Okay, so we'll for now though, next month's meeting we'll keep to the morning as a hybrid. March to be determined still. Okay. Okay, and then we need to look at approve the minutes that were provided. Karen sent us the September meeting minutes. I guess it would only be Mark and I that could respond to this, though.
I sent the November ones out too.
That's
And
right.
Mark made edits and I sent them all out to you
Yes,
again.
yes.
There were a
And
few
it-
tweaks. Yeah,
Okay.
but you're correct.
Okay, so Mark, well, you've reviewed these September meeting minutes and I've reviewed them and I approve of them as they are now. Right, so. And Mark, I assume that you do as well? Since you,
Yeah, so I'll move to approve the September and the November minutes as circulated by Karen, the revised versions.
okay, and I second that and I'm in favor and
I'm
you're
in
in
favor.
favor? Okay, thank you. Thank you, Karen, for getting that done. Okay, and is there anything else that I have forgotten? With a little bit of COVID fog here. Okay. I guess we're good. Okay, then do I have a motion to adjourn the meeting?
I'll move to adjourn the meeting.
And second, and all in favor? Randy, Kurt, Mark, excellent. I think we're done. Thank you. Thank you
But it's
for,
done by quarter, I said 8:45, bam.